My name is Claus-Henning Köhne. I'm a medical oncologist, and I'm based at the University Department of Hematology and Oncology in Oldenburg. Tumor characteristics influence treatment decision-making mainly based on molecular parameters such as the RAS mutational status. We know that patients who have a RAS wild-type disease may have a very good outcome when treated with an EGFR inhibitor. They have a better response, they have an earlier response, the depth of the response is better, they have a better likelihood of having a secondary resection, and the chances of surviving are statistically and clinically much better, clinically relevant, much better as compared to other treatment options. BRAF mutation is at the time being more a prognosticator rather than a predictive factor. However, it will probably in the future help to select patients better for specific treatment for this specific parameter. We are knowing for a long time that the tumor location of the tumor in the colon is impacting on survival or on the prognosis. In the fact, or in the matter that left-sided tumors have a better prognosis than right-sided tumors. Current retrospective analysis of the CLGB was looking at patients who are having a left or right-sided tumor and whether this may have an effect on the treatment outcome. This had been shown before by the FIRE3 data, where patients having a left-sided tumor had a better outcome when treated with cetuximab as compared to bevacizumab. CLGB actually showed a very similar result, that also patients having a left-sided tumor derived more benefit from an EGFR inhibitor, in this case also cetuximab, as compared to the VEGF inhibitor bevacizumab. To me, we have to determine the RAS mutational status before we choose the first-line treatment for patients with metastatic colorectal cancer. This has been shown in several trials, and the positive outcome in terms of a significant gain in overall survival has been made clear. That this has been achieved in patients with RAS wild-type disease if treated with a doublet plus cetuximab, for example, as compared to other treatment options. On the other hand, we also know that left-sided tumors, being RAS wild-type, have a better outcome as compared to right-sided tumors, also being RAS wild-type. This is just an additional information, and we should never forget to look for the RAS mutational status before we choose any treatment in first line. Actually, the CLGB data raises more questions than answers to how best treat patients who have the tumor on the right-hand side. The data doesn't really convincingly show that patients do benefit from the addition of bevacizumab to chemotherapy, nor do they convincingly show us that patients derive a better benefit when cetuximab is added to chemotherapy. So here the jury is open, but it's probably more open in the fact that better to describe the molecular parameters that are more frequently mutated, for example, if the tumor is coming from the right-hand side. future holds a lot of options for patients with metastatic colorectal cancer. We now know that patients with RAS wild-type tumors should be best treated with an EGFR inhibitor. We now know that patients who have a BRAF mutation unfortunately have a poorer outcome, but there's data on the horizon that combinations of a BRAF inhibitor, a MEK inhibitor, and an EGFR inhibitor may be of benefit. And I'm sure the treatment will become more complicated in the future and much more individualized than what we have now.